All right. So, hi there. I'm Vivi. I'm a health coach, and we have here Debbie, who was willing to answer some of our vaccine questions, to call them like that, because I feel like a lot of people have questions about should I, shouldn't I, what are the risks, a lot of like controversy about this topic. So we were just talking and thinking maybe we can bring a little bit more clarity for some people, even for myself included, because I didn't do the vaccine yet and we are like debating about it. And Debbie here, she's working in integrative and functional medicine and would be really appreciated when a point of view from this perspective. So Debbie, if you can just introduce yourself and tell us a little bit about yourself, and then we can go more deeper.
Sure, Vivi. Thank you so much for having me today. I am Debbie Conner. I am a nurse practitioner, board certified in adult and family practice. I've been a nurse practitioner for a really long time. And I enjoy my practice now, which is functional integrative health. It's a very small piece of what I do every day. I am doctorally prepared. I do research and teach nursing education. So I'm real excited to chat with you today. I do want to say that I'm not going to give you an opinion, that anything that we talk about is based on fact or data. If I can't give you fact or data-based response, I'll let you know that it's anecdotal. So I'm not going to tell you if I'm getting one or not. And I'm not going to suggest that you get one or not, but we can talk about what we know are the pros and what we know are potential risks, etc.
Right. And if we were to think, Debbie, in the end, it's everybody's choice, right?
Right.
We're not here to say you should take the vaccine, you shouldn't take the vaccine. It's up to how you feel, and it's your choice what you feel like you want to do about it. Listening to, some points of view out there.
Right. And there
So,
are lots of points of view out there. So let's try to stick with the facts.
yeah, and a lot of points of view, and not just that, a lot of types of vaccines. Like, can you just mention the types of vaccine and maybe why there are so many, Debbie?
Oh, absolutely. Well, first of all, let's do a quick review on what vaccines are there for. We
Mm-hmm.
have vaccines for an awful lot of conditions and diseases. Vaccines have been around for a very long time, and most of them are extremely safe, right? So
Mm-hmm.
what they do is they stimulate our immune system, which is basically white blood cells, specifically T and B lymphocyte. A lymphocyte is a white blood cell, to fight off a disease. Okay, so the vaccine works by causing your body to think influenza has just attacked it, or measles, mumps, rubella,
Mm-hmm.
etc. And it causes an immune response. And then these little memory cells, the T and the B lymphocytes, just kind of hang out in the body and say, okay, we're just waiting. And that virus comes back and they're like, come on, let's go. And they go and they get it. And you don't even know that you were infected. Okay. So
Mm-hmm.
there's a number of different vaccinations being worked on, but we only have two right now, two types that are approved for emergency authorization use. They're not approved drugs, but they're still under clinical trial. And one is called the messenger RNA. That's the Pfizer and the Moderna. And that vaccination was developed. They've been working on it for a long time for Ebola, HIV, and some other conditions. But in this case, they took the technology and took a little piece of material from the virus to teach the cells to make a protein, which is the little spike you see on that picture of coronavirus,
Right.
and to go into the cells and put a little bit of genetic material in the cells. Then the lymphocytes go and they fight it, and now they've got that memory cell. So it takes a little genetic protein and it fools the cells into thinking the spike is there. It's really not the spike. It's not anything from COVID, but it fools the body. So that's the mRNA. The other one is viral vector. Viral vector has been around for quite since the 1970s exactly. It's a modified version of the virus taken from some material. So it's an inactivated piece of protein from COVID that goes inside a shell of a different virus. It happens to be an adenovirus, which is the common cold, which is what COVID is, an adenovirus as well. But it unfortunately has these spike proteins. So that the virus, the deliverer, goes into the cell. It's got the piece of inactivated protein hidden in it. The cells go, ooh, this is bad. They mount an immune response, and then you have the memory cells. So the Johnson & Johnson, the one-shot deal, is the viral vector, and the Pfizer and the Moderna, the 2 shots, is the messenger RNA. That's really the simplest way to describe how they work.
That's very interesting for me, Debbie. It's like simple way of putting it in like not so many medical terms. Is like one of them is because we all know in a way, oh, when it's a vaccine, they put a little part of the virus inside you, so the body will create the antibodies, and then you'll be protected. And now you just explained very clearly the difference between the two. One doesn't have any part of the virus, and the other one, it doesn't have part of the. It's an inactivated part of the protein of the virus. So that's a really good explanation. And now you just mentioned like the first two have 2 shots and the second one has only 1 shot. Why is that? Why the first one has 2 shots and the second one only 1 shot?
I'm not certain that I understand all of the science behind that.
Mm.
My hypothesis is the first dose, because it's messenger RNA, it needs an opportunity to kind of create some reaction, build up some reaction in the system and some antibodies. By giving the second dose, it very quickly wakes up that system and goes, oh, there it is again. And it mounts a fiercer response, which is why you may have heard that after the second vaccine, some people experience a fever, malaise, fatigue, body aches, and some other symptoms that have been reported where they didn't have it in the first injection. So that makes perfect sense to me that the body is just being introduced to this and says, oh, we need to do something about it, and remembers it. And then the second time they're like, oh, no, we don't want this, and mounts a stronger response. Because the other virus is using a protein, and the response is immediately, because that protein gets introduced to the cells and replicates within there, you get that mounted response the first time with seemingly less reported side effects, but it hasn't been out that long. So, I'm still waiting to hear more.
All right, that's very interesting. And one question that comes in my head right now, Debbie, the 2 shots, are they the same?
Yes.
All right, okay.
They are exactly the same dose, the same brand. You're not supposed to mix your don't get a Pfizer, then a Moderna. No, it's supposed to be 2 shots of the same brand.
Oh, interesting. I don't know why in my head it was like, it's like an addition to the first one. The second shot I thought is like an addition, but it's exactly the same one, but it's like triggering the immune systems twice so you can get more of those antibodies.
Right, so think about the MMR series, measles, mumps, rubella. And I don't know if you have children or not, but it's 2 vaccines. And so your kid gets one at a certain age, and it's combined, they're all together. And then a couple of years later, they get a second one. And then that for a very long time was it. There were no more, you did not get any more. Now, unfortunately, there's been a need to have a third of some of the pieces of it, but that's another topic for another day. So I see this similar to how that immune response needs to be mounted.
All right, That sounds very clear, Debbie. Like that's really good comparison between them and explanation. Now I'm wondering, from what you have seen so far, from your experience, or from the research that they are still doing, how effective is the vaccine?
We don't know yet.
All right.
So we know that in clinical trials, which are still ongoing, before emergency use authorization, the Pfizer and the Moderna vaccines were about 95% effective. They were tested prior to the variants. The variants are where the virus has mutated slightly. So it's a little different virus. And they're from Brazil and the UK. You've probably heard about these variants. California has its own variant. And it makes sense well, we're not going to go into all of that immunology stuff. So the efficacy is very good on them. And the Johnson & Johnson in the US was very good on it. But Johnson & Johnson was tested later when the variants were already out there. So its efficacy rate is a little bit less than Pfizer and Moderna. But the purpose of the vaccination is not necessarily to prevent COVID 100%. It's to reduce the severity of the illness, hospitalizations, and death. And all three of them were approved because that data was substantial. Johnson & Johnson, for example, has 100% no hospitalizations or deaths in those who have contracted COVID. Now, I know and read about several people, I forget how many now, who ended up testing positive for COVID after their vaccinations. Here's the convoluting factor, is that did they have COVID already when they went in and got the vaccine? Or did they contract COVID in the 2 weeks after the vaccine when the immune system was building up? So we don't know. We don't have an answer. And they didn't promise us that we would be COVID free. We also don't know how long the antibodies last. There has been talk of being expected to have to repeat the doses every 6 months, a 1 or 2 booster for Pfizer and Moderna. There has not been that conversation for Johnson & Johnson yet because it hasn't been around as long. We don't have the answers yet.
So could we say that it's a prevention for the time being, for the present moment? Like if you, like for people who have underlying disease or for people who are more at risk with their immunity, that it's a way of preventing getting into the hospital or affecting your health worse than or you already have it.
That's correct. The other thing to remember that I think is really important and we need to think about very seriously, and I don't care what side of politics you are on this matter, is that masks, physical distancing, and good hand hygiene, which we should be doing anyhow, is going to need to continue for some time. Because the vaccination, while it might prevent you from having the symptoms of COVID, does not prevent the virus from accumulating in your nasal pharynx and you being an asymptomatic spreader to somebody else with or without the vaccination. And in the US, Dr. Fauci, who is the head of immunology at the National Institutes of Health, finally said what has been talked about in and written about in medical communities, that we were going to need to wear masks for a while because of this asymptomatic spread. But like you said, it's to help you to hopefully not have a serious case of the virus and untimely hospitalization or death.
And now, Debbie, which are the risks? Like the same from what you have been reading and study, like what are the risks? Once for a person who is healthy, who just feels like she or him wants to protect, or for a person like personally, I'm thinking about my mom. My mom had cancer 2 years ago, so her immune system, because she did chemo and radiotherapy, is a little bit lower than other people. So I'm wondering, what are the risks for a healthy person, and what are the risks for a person whose immunity is not that strong?
So it seems that the most severe risk potential is an allergic reaction. In the messenger RNA material, if you were to look at the CDC website, or actually if you looked at Pfizer and Moderna's website, they talk about some of the materials that are in the vaccine that you could potentially have an allergic reaction to.
Mm-hmm.
If you know it, you're supposed to identify it, have your EpiPen handy, and they watch you for a longer period of time. I know of one nurse practitioner who had an allergic reaction an hour later that required intervention with 911, et cetera. And a couple of, I think 3 people who had some allergic reactions, they just stabbed them with the pen and it was done. But we don't know.
Mm.
So, there's lots of stories out there of things that happen, and they're all reported to the vaccination registry. So if you were to go online and look up a vaccination side effect report, I think it's vser.org, but I may be incorrect, you can read what people are reporting. And most people are reporting the fatigue, the body aches, flu-like symptoms, high fevers. But for example, your mom may not mount the same immune response that an otherwise healthy person at the same age did. So our immune responses decrease over time. And if we are immune compromised, it might be more difficult. So let me take my sister, for example.
Right.
My sister has multiple sclerosis. And she has been under a whole lot of treatments for her multiple sclerosis over her lifetime. And she had, after her first vaccination, under doctor's recommendation, she had night sweats for 2 weeks, which meant she was having a fever and it was breaking at night, right?
Right.
Her second one caused her to have an elevation in temperature that actually affected her multiple sclerosis symptoms, where she had a limited use of her extremities, difficulty walking, some problems with vision. So it accentuated the problems that she already has from her condition, but her physician said most people were coming back to baseline after a couple of weeks. People who've had fillers in their face have had some facial swelling because of a reaction where the body now thinks that's a foreign object as well. There has been some other reports of folks who have herpes simplex who may have had an outbreak. We don't know enough, and we don't know how healthy we are on the inside.
Right. And Debbie, it sounds a little bit like, from all my research with the health and the immune system, it sounds like when you have an underlying disease, let's say like multiple sclerosis, your immune system is compromised. Your immune system has to do a lot of work. So when you bring like a foreign body inside you, it's like the immune system doesn't take the time and the energy to just put it for the underlying disease that you have already. So it's like it's like taking a break from that and trying to deal with this one. And maybe that's why that multiple sclerosis is getting a little bit slow or affected, or in this way.
That's a really good point, Vivi. And we're smart. Humans are very smart. The body is an amazing piece of machinery, but we're not that smart. We don't know the difference between a foreign body we put in there to make our cheeks pretty and a foreign body that could potentially kill us, right? Think about chemotherapy. It kills all the cells. It doesn't know if they're good or bad, right? So I think that that's part of the risk and the benefit profile in your consideration of what you're going to do, is weighing, and that's like, we struggle the risk. Do I want to get COVID and be okay like Jane Doe, who had lost their sense of smell and taste, felt kind of yucky for a couple days and went on about their business? Or do I want to take a chance and be like those patients that we see the photographs of in New York City and be on a respirator and all of these side effects and possibly die or have long hauler syndrome?
Mm.
Do we take something that has not been studied, like a traditional vaccination or medication, that we don't really know how long it's going to work? Is it going to do something to us long term? We know nothing about it, but we don't want to be here. You know, when my husband was making the decision, he kept going vaccine, death. And I couldn't tell him what to do. And I couldn't tell him the stories that I was hearing either way, because he had to make his own decision.
Right, right. That was close to my next question. When people are debating, should I, shouldn't I? Like what they should ask themselves. And you made some really good statements there. Like you should look at your individual case. What is happening with you and what are the risks you are taking or not taking long term? So thank you for answering in advice to my question.
It's the same question you should ask yourself anytime a healthcare provider wants you to take a prescription medication or have a procedure or have surgery. What are the risks? What are the benefits?
Right.
And do the benefits outweigh the risks? Because you have to sign a consent, either implied, you fill the prescription,
Mhm.
or on paper, you have a procedure done. And through ethical principles, it's all about risks and benefits.
Mhm.
And that, you know, I have to have a procedure done this summer
Mhm.
because there's something that needs to be taken out of me that is known to cause um, a rare type of lymphoma.
Mhm.
And but it's not in everybody. So do I want to kind of just leave it as it is? It's going well. Or do I want to take that risk of maybe having lymphoma?
Mhm.
And right now, you know, I've scheduled the appointment and it's going to happen. But there's risks to that
Right.
procedure as well.
Right. That's a good point, Debbie. With everything, I feel like people should try to not just take a decision right away, but reconsider a little bit. Like even with simple medication, because all of the medication has a side effect. It helps us on one way, but on another way, it has a side effect. So you really need to weigh these benefits and risks. And if you can maybe treat that naturally and with some like healthy foods and like a lifestyle that you can change it, or you have to take the pill, because the easy way is I'm just gonna take the pill because it's like faster. It's like how we have been trained to think. But also like you can try to search what are my options. Do I have to take the pill or I can find another way of, and if I do take the pill, what are the risks, what are the benefits? That's a really good point with everything, not
Well,
just.
that's a really good transition to what other options might be out there. And I'm not saying don't get a vaccine.
Mhm.
I'm saying you have to decide for yourself. And it's a very difficult decision for many people, and it's a very simple one for others. And please, please don't let politics
Mhm.
weigh into this decision, because that just makes it more complicated. But we know that our immune system, which is fabulous and very smart, it's just not smart enough to do certain things like knowing that a protein really should be there. But we know that people who have gotten quite ill were defective in their levels of vitamin D, D3, right? So, and we know that they were defective in their zinc levels.
Mhm.
So we know that supplementation with vitamin D3 and zinc is warranted in these cases. And you can read, it's all published, it's all out there.
Mhm.
We also know that there are other supplements, such as Q-certain, that help the body to clean out the white blood cells that like are old and dead and just kind of need to go,
Mhm.
and help to boost more. But Q-certain does do affect on some other things like thyroid hormones and stuff. So you don't want to just take them without consulting with someone like you or someone like me or your healthcare provider, your MD, your physician, your nurse practitioner, your physician's assistant. Um, so we know vitamin C helps. We
Right.
think elderberry helps. This is
Mhm.
very similar to the flu, where every flu season I pull out the bottles of stuff that we take, um, and they've worked real well. We know that MCT oil, coconut oil, seems to help in when certain viruses to encapsulate them and eliminate them from the body. A conversation for another day, but there are some things you can do: eating well, eliminating sugar, getting exercise, reducing weight, trying not to be stressed, which affects your immune system horribly,
Mhm.
um, washing your hands, wearing a mask, and physically distancing.
Mhm.
And don't let politics get in the way of your health.
Okay, I feel that's a strong statement you have to do, Debbie. Don't let politics, because in the end, if you look, it's your own case. Nobody out there would, not that they don't care, but they don't care that much about your own personal health. And it feels like you have to take it into your own hands. And you just mentioned amazing ways of just doing it, starting it. Let's say maybe you're not ready to take the vaccine yet. Maybe you're still debating. You have here some variations that you just mentioned, like all these supplements that can strengthen your immune system, that can make you a little bit stronger for another way of preventing to get COVID and spread it and continue this pandemic, to say it this way. So um, now I'm just wondering, Debbie, for how many times will we have to take it from now on? I don't know.
We don't
Or
know. Like I mentioned earlier, they're thinking we might need a booster. Is it every 6 months? Is it every year? So
Mhm.
nobody's had it long, the vaccines, long enough to know how long the antibodies last, right? I mean, there are people who are in the clinical trial, but we're not getting those data. And so we don't know. But
Mhm.
remember, it doesn't prevent it 100%. Just like influenza. The influenza vaccine success rate is between 10 and 40% a year. They never get it right.
Mhm.
So do you take a flu vaccine, or do you wash your hands and take, all your vitamins and supplements and eat well during flu season and stay away from people?
Mhm.
I've been doing that for years.
Right. Is that true, Debbie, that I feel like last summer, when it's hot and it's different weather, there's not so much thought about COVID. When it's winter and it's cold, it's everything about COVID. Can you talk a little bit about that? Like, is it the weather actually influencing the virus and the
No,
presence in the air? And
no, the virus doesn't seem to, and at first they thought that the virus would disappear in the summertime because it was warm and it would die. I'm not sure where that thought came from, if it came from science or political leaders that were speaking. I don't know. But what ends up happening in the summer is people are outside more. And so if they are outside safely and they're still washing their hands, and if they're in close contact with someone and wearing a mask, the numbers drop because you're outside and that's good for you and you're healthy and it doesn't seem to carry in the wind.
Mhm.
And then in the winter time, everybody's in the house. And people, that's what flu season is. Well, everybody's in the house and it's transmitted easily to people, but we had a non-existent flu season this time. Wonder why? Masks, social distance, and washing your hands. General hygiene. So I don't know what's going to happen. Let's see what happens with spring break. It's warm out in a lot of places. Let's see what happens with 4th of July. I think it has to do more with proximity to people
Mhm.
versus the temperature outside.
Versus the weather conditions.
Yeah.
Okay. All right. That makes sense. Now, Debbie, we know that functional medicine and regular medicine, to call it like that, they are a little bit different because they take different approaches. Can you tell us a little bit, like regarding the vaccine, what integrative and functional medicine protocol is? Like, what are you doing maybe different from regular medicine? if that's a right
Well,
question.
I don't think that I could attribute it to the vaccine, right? Because everybody has to make that own decision. But some of that supplement list that I shared with you, that comes from the functional medicine perspective. It's actually a protocol for one of the top medical schools in the country. So it's been published.
Mhm.
Some of the best thought leaders on healthcare and being healthy are talking about the the supplements, the diet changes, etc. Um, but from a vaccine perspective, no, it's not like, for some of the kids' vaccines, hepatitis, the measles, mumps, rubella, etc. There are homeopathic versions of it that you would take to prime your body to get the most benefit with the less risk out of the vaccination. That's the thought of it, but
Mhm.
a whole nother conversation. We don't know enough about COVID.
All right, I feel this is important, Debbie. So, for a person that is not ready yet to take the vaccine, but they want to prevent, they want to still be healthy and support their immune system, can we repeat those supplements that you mentioned earlier, that they are also published out there? That.
Right. So the first one is vitamin D3. You
Mhm.
want to know what your D3 level is to begin with, and then work with your healthcare provider or a health coach or whatever to determine what the dose of D3 should be. The other is zinc. Again, with your healthcare provider, knowing what your levels are, it would be anywhere from 30 to 50 milligrams once a day.
Mhm.
Uh, Q certain, again, that has to be cleared through a healthcare provider. Vitamin C, I take 2,000 milligrams twice a day. I had to work up to that. That works as a very good laxative. Vitamin C will. So you want to work up to a dose that you find comfortable for your body. There are others out there that, with the right provider guide, you can figure out what you need to take.
Mhm. And you also mentioned like elderberry or like MCT oil, like coconut oil. Like if you like, let's say, you can substitute those vegetable oils in case you use them with more of like MCT oil, or not necessarily MCT. That's like the other level of coconut oil. You can start with coconut oil and just try to make little changes in your lifestyle, in your diet. We all know how wonderful vegetables are, and we all know how many benefits and how much they support our immune system. So, starting there, it's still a good step to move
Absolutely.
forward to support your system.
Absolute. Diet has a lot to do with our health. People don't realize how integrated what we put in our mouth is to how we feel.
Mhm.
Um, and there are lots of different ways to eat healthy out there now. And you and I practice a similar way of eating healthy where we get lots of vegetables and
Mhm.
healthy foods. If I was to make one suggestion, it would be to cut sugar and all of the chemical sugars and stuff out of your diet
Right.
and eat, use fruit for flavoring if you need sweeteners, if you, until the point where you can get away from that, if that's your choice.
Mhm.
But sugar has been a leading cause of obesity and diabetes. And we know that individuals who contract COVID, even if they're young and relatively healthy, that are pre-diabetic, diabetic, obese, have had poorer outcomes than others.
Right. And then when we talk about sugar, we're not talking about just the refined sugar. We all know. And if anyone needs to know a little bit more, we have a list with so many hidden names of sugar, because that is important, because the food industry understood that, hey, they talk about sugar for a long time. This white powder is not so good for the human body.
Right.
So let's call it differently. And they got it, all sorts of other names, like I'm just mentioning like maltodextrin or dextrose or everything that's syrup or like all those things. So in case
It is so frustrating to go to the grocery store. I wanted to get some sliced turkey breast from the deli. And something told me to ask about, to read the label. It had maltodextrin in it.
Right.
Everything, there's one product we can buy it's a pastrami meat that
Mhm.
has nothing in it. Nothing. One out of a whole case. The sugar-free salad dressings. A medication that my son takes has sugar and corn syrup in it.
That
It's everywhere.
that's another that's so if you let's not just talk about diet now, but the only thing I would encourage a lot is check the ingredients list. You'll be surprised. I'm amazed how much medicine has corn syrup. I'm just amazed. For kids, the little vitamins, the gummy vitamins, they have sugar in it. That's just like for me. What are they doing? They're taking vitamins for something, and then in the other on the other hand is like it doesn't match. I'm shocked sometimes. So yeah, now talking about kids, Debbie, we know that they've been like with COVID privileged in a way, right? Their immune system is stronger. They are like they have been a different way of getting around COVID. Do they have to take the vaccine?
We don't know that yet. They're still doing testing in the vaccine. Right now they're doing, I think, adolescents, so 13 through 17. There was one report that I have not verified. It was on the media that said that a mom who had had the vaccine had passed, or had the virus, I don't remember, had passed the antibodies to the breast milk to the baby. We don't know. We'll see.
Mm-hmm. All right. Okay. Um, Debbie, right now, I'm just wondering if you have any thoughts that you wanna or any suggestion that you wanna do apart from everything that you just said, like for people out there that are like maybe concerned. What would you tell them as a last message?
Read the data. Look at, I mean, some places have it pretty good English, like Johns Hopkins,
Mhm.
the CDC. Try to look at data, not what your neighbor says, not what Facebook says, certainly not what the media says, and certainly not the whole political piece behind it. Try to make your best effort decisions made on data. If you ask your healthcare provider, don't say, should I get the vaccine? Ask them, are you getting the vaccine? If I was your daughter, would you do this? Why
Mhm.
or why not? We don't have a lot of answers right now. We have more questions than answers still, but
Mhm.
we've come a long way in a year. Our numbers are dropping, hospitalizations are dropping, and deaths are dropping. Um, Try to be healthy, try to move every day. If I can't get out for a walk, at least I have a stand-up desk. I try
Mhm.
to do something every day. I eat well, and I'm staying away from people. When I go into a situation, I wear a mask, I stay away, I sanitize my hand, and I do not like hand sanitizer. I don't think it's great for us, but right now it is what it is. And I hope for the best. And I hope for your good health and everyone that's listening to our little chat today.
Yeah, we hope for good health for everyone, like everyone, and good positive thoughts. Like
Yes,
if you
ma'am.
keep yourself positive and hopeful and healthy, that's what we need to thrive, right? Thank you so much, Debbie. This was amazing, and I think it's a lot of good information and good questions for people to just ponder on and understand more about the vaccine and understand more, do I want to or do I not want to take it? So I really appreciated this. Thank you so much.
You're welcome.